200,000 Americans undergo weight loss surgery every year. They choose methods like gastric bypass, banding, or surgical balloons to shrink the stomach down and decrease your food intake. Well, now doctors have another option for patients when diet and exercise are not enough. We warn you, though, there are some graphic images in this story. Leslie Mouton has more.
The most I ever saw on the scale was 409 pounds.
Standing 6 feet 4 inches tall, 44-year-old Eric Wilcoxon leaves a big impression. These days, Eric is more than 135 pounds lighter after a lifetime struggle with diet and exercise that impacted his life and his health.
I sat in my chair for probably the last 2 years before I had this done.
You know, when it's your husband, you don't want it to happen to him. It even makes me emotional now. But I don't want him to die.
Dr. Vladimir Kushner recommended Eric undergo an endoscopic procedure to implant the Aspire Assist.
Well, the device is a modified feeding tube with a larger internal portion and a small external portion.
30 minutes after a meal, Eric connects the tube to a water canister and pumps out about 1/3 of his stomach.
Similar to what happens with weight loss surgery, some of the food that you eat just doesn't go where it naturally would, which helps you to lose weight because you don't absorb quite as many of the calories.
And a lot of people do think it's gross, but I'm really not overly concerned about what a lot of people think.
Eric watches what he eats in order for the Aspire to work. He drinks a lot of water and he chews his food a lot.
People don't comprehend how much you have to chew your food in order to do this. This tube that's in my belly is no bigger than an ink pen sitting on your desk.
But Eric credits that tube, plus a healthy diet, with allowing him to do things he couldn't before, like coach his son's football team. Leslie Mouton, KSAT 12 News.